Dementia Researcher with a blog and a rating.
Public awareness. As a researcher and a clinician, it is part of my mission, so to speak, to spread awareness of some of the lesser known aspects of dementia. In my case, it is the language difficulties known as aphasia and the speech difficulties known as apraxia or dysarthria. Having this kind of impact is slow work, but this morning, following a terribly sad announcement from Bruce Willis's family, public awareness has dramatically altered. Now, Bruce Willis's daughter spoke publicly via Twitter to announce his diagnosis of aphasia. Bruce has not had a stroke nor a brain injury, both common causes of sudden onset aphasia. It appears he's developed it gradually. In her tweet, Bruce's daughter also explained that Bruce Willis's aphasia is also associated with cognitive difficulties. Now, aphasia is defined as a language impairment. In reality, aphasia is quite variable and affects people very differently. Most often, it results in difficulties getting words out. So people with aphasia have difficulties associating meanings with words, or they may struggle to think of a word, even when they know what they want to say. In the latter case, it may feel that the word is on the tip of their tongue. I mean, it happens to us all occasionally, but I mean every sentence in the case of a person with aphasia. People with aphasia may say apple when they mean pear, making category errors, or they may not be able to get the sounds in the right sequence and produce a kind of word salad. For example, animal may become manimal. This can impact nouns, verbs, or even more broadly grammar. A person with aphasia may also have some difficulties understanding. They may not be able to follow what someone else is saying. They may ask what a word means or might lose track of what's been said exactly. Now, people with aphasia may be assumed to have much more significant cognitive difficulties due to their problems in accessing language. Almost every time we interact with other people, we speak to them, we use language to communicate what we mean and we listen to what they have to say. So people with aphasia are often excluded from conversation and social interaction. And many of the people I work with describe experiences where people have presumed they can't remember things, they can't decide things for themselves, or they can't do most activities of their daily living. However, importantly, people with aphasia often can, with the right support, do these things. And speech and language therapy is one type of support that can offer this. As a speech and language therapist and clinical academic, it's my goal to increase public awareness and thereby, hopefully, increasing things like commissioning for NHS services and ultimately help people with aphasia lead a better life. It is every researcher's dream to improve people's lives. To do this, we try to spread the word. I have in the past written blogs, I've done podcasts, I've presented all types of workshops and conferences. But this terribly sad news will have a positive effect. For every person who has aphasia, be it as a consequence of stroke or brain injury or dementia, Bruce Willis and his family have changed their lives, the lives of these people living with aphasia in the world, for the better. I am terribly sad for Bruce, but I'm also incredibly grateful that he and his family felt able to share this news.
Thank you for listening. Join the Dementia Research bloggers and share your own views.